And we find at AAPS that cash practices are growing. I was doing some research for this talk, and I found that before World War II, an office visit to a general practitioner cost $2. Only $2 you get an office visit. Well, those were the good old days. What's happened, of course, is insurance has moved in and it's driven up the price and cost of everything. And when you have a third party pay for something, then there isn't the supply and demand mechanics that keeps prices low. And prices go through the roof, and doctors end up spending a lot of their time servicing the demands of the insurance companies. And a number of doctors have opted out of that system because cash is so efficient, and it's such a superior way of practicing medicine when the patient comes in and pays cash for the medical services. Statistically, in 2005 and 2006, according to the CDC, 11% of physicians had no managed care contracts at all. 11%, and we think that number has increased. A 2008 survey by the Texas Medical Association found that 38% of primary care doctors in Texas only 38% of primary care doctors in Texas took new Medicare patients. So 62% of doctors in Texas took no new Medicare patients. We see the number of doctors who practice and have an elderly patient population, a number of them have opted out of Medicare. In New York, there's a substantial percentage of doctors who refuse to participate in the insurance plans of certain carriers, particularly Aetna and Blue Cross. So 11% of the doctors in a region of New York City don't participate in two of the major insurance plans. We see anecdotal evidence where psychiatrists in particular are opting out of the insurance because they find that the results are better when the patient pays for the psychiatric therapy. When the patient it's the patient's own dollars who are paying for the treatment, the value of the care, the results with that patient tends to be better. We have people who are with AAPS who have gone all cash. They find that their volume of patients they see each day goes down, but they're able to spend more time with each patient, and their satisfaction with their practice goes way up. And there have been some press articles about that. All right, what are the benefits? The benefits of going to cash. Well, one is that a higher percentage of your time is spent on patient care rather than on paperwork. And that's worth a great deal. So you get to the end of the day, if you're in a cash practice, you've spent more time that day seeing patients and addressing medical issues than you have doing paperwork. Well, when you're dealing with a lot of third-party payers, including insurance companies and Medicare and so on, increasingly you spend a higher percentage of your day on paperwork, and that's not what you went to medical school to do, I'm sure. There's less stress when you go to cash. There are no audits. There's no feeling you have to comply with what the insurance companies want. There are no threats. You don't have to be a covered entity anymore. You don't have to comply with all of HIPAA's rules because you're not doing electronic transactions. Your patients are much happier. Your staff is much happier. I notice that as a patient when I go to a cash clinic, that the staff is happy to see you because you're a new paying customer. When you go to a doctor's office that's heavily insurance-based, the staff is unpleasant for the patient because each new patient is an additional problem for the staff. But as a patient, when you go into a cash clinic, you're more money to that cash clinic. You're going to be paying with a credit card or whatever. You're not a hassle for the staff. You're someone who's going to bring them more rewards at the end of the year. When a patient is unhappy with services that the patient received from a cash clinic, the patient can ask for his money back. There's a remedy that the doctor can provide short of a malpractice lawsuit. So we see that there are fewer malpractice lawsuits against cash clinics than there are against clinics that rely on insurance reimbursement. Because in the cash clinic, the doctor can say, okay, you're not happy, I'll give you your money back. It's like Federal Express, right? Federal Express says, if we don't deliver your package on time, you can get your money back. And that gives a remedy to the customer. There's no remedy. If you're taking insurance and you have an unhappy patient, there's no remedy that you can give to that patient. There's no money you can give back to that patient because the insurance company has paid for it. So the patient looking for a remedy is more likely to sue. The patient base that you have when you're in a cash practice is more of a population that believes in free enterprise. It's less of the entitlement mentality. So you have a better population base that you're drawing upon. You have people who understand that when you want something of value, you pay something of value. They're not people who are looking for something for nothing. But when you have a patient population that's heavily Medicare insurance, you've got people who are often looking for something for nothing. And that's going to lead to more malpractice cases. There's no rationing of care when you have a cash practice. You can offer all sorts of additional tests to the patient, and if the patient wants to pay for those tests, then it's just like any other transaction in the free market, right? The patient wants it, the patient would like. If it's an elderly male, the patient may want a PSA test every 6 months for his prostate. He can pay for that. It's not that expensive. Medicare will not allow that. If the patient is in the Medicare system, Medicare will only allow that once a year, a test of the patient's PSA. And insurance companies, presumably they often follow Medicare, so they may allow that only once a year also. In a free market, a patient can ask for that more often, and the doctor can offer those additional services to the patient. There's no rationing of care in a cash clinic. Innovation can develop much easier in a cash clinic. The doctor can be more creative, and if the demand is there to meet that creativity, that's where we're going to get the new developments in medicine. Insurance companies don't like innovation at all. If you innovate, and insurance company is paying for it, the insurance company is likely to deny payment, give you trouble, report you to the medical board, etc. So there's no innovation can develop in an insurance-based system or in a Medicare government-based system because they don't want to pay for something that's new. All of the innovation comes out of the cash practices where the patients are trying things that are new and they're willing to pay for it. If you look at LASIK surgery, LASIK eye surgery, that did not come out of the insurance system. That did not come out of government-paid system. That came out of free enterprise. I spoke at a medical school, and I gave this analogy. When you need something, you need to send something that gets to the destination the next day, what do you think of? Do you think of the post office first? No, you think of Federal Express or UPS. Well, Federal Express did not come out of the post office. That next day service, delivery that all of us rely on so heavily now, that innovation did not come out of the post office. That came out of the free market. There's a demand for that, and then the supply meets the demand. Well, same thing with medical services. All the innovation in medical services that we need that could be saving patients' lives is going to come out of cash practices. It's not going to come out of a government system.